Alright, so I'm going to do an oral care. So the first thing I need to do is check the patient's chart, gather all the necessary things, and wash my hands before I enter the patient's room. Always when I enter the patient's room, introduce myself, check the patient ID band, wash my hands, and always apply the appropriate PPE. So when I'm ready, once I have my appropriate PPE on, so I'm going to go ahead and assess the patient, listen to the patient's lung sounds, check to see where their endotracheal tube is placed, make sure it's in the proper placing, and always check the cuff pressure on the patient, see how that is. And then I'm also going to always chart down the vital signs before I do any procedures and see kind of what this lung sounds like. So when I'm ready, I'm going to go ahead and get my suction catheter canister here. So I'm going to plug this up here. It's going to have a little thing, and I'm going to set it up to my suction vac. So that suction vac, I'm going to turn it to -100 and -120 for an adult. And so then when I'm ready, I'm going to go ahead and do my first treatment. So the first thing I'm going to do is set up a Yanker suction and with a suction handle. So what you're going to do is you're going to apply it to here, and you're always going to check to make sure it works properly. So you can even suction up some sterile water if you want to double check and make sure it's suctioning properly. But when you're ready, you would remove the sheath back like that, and then you're going to go ahead and go into the patient's mouth, and you're going to get the side of the cheeks, make sure you get all that excess, any fluids in there, any secretions that may be there, and always get the back of the mouth. But when you're doing the back of the mouth, make sure you're not hitting the gag reflex. So when you're done, always cover this back up to protect it. And when you're ready, go ahead and place this in a safe area where it's going to keep clean. And so the first thing we're going to do is a suction swab. So you want to clean every 2 hours. So what you're going to do is we have a suction swab here, and you're going to attach it to your suction handle like this. You don't have to have your suction handle on at first. And so what you're going to do is take it into your oral solution here. And so you're going to take this, and you're going to go on the side of the cheeks, on the tongue, around the gums, and the roof of the mouth. And so when you're done, you can suction, turn on the suction, and suction any excess solution or anything like that that's in the mouth. Then you're going to go ahead and dispose of this. And then you're going to set this in the appropriate place. And then you're going to take your applicator swab. And so here we have moisturizer. So you want to always apply moisturizer. So you're going to place it on like toothpaste. And then you're going to use this, since it's clean, you're going to go ahead and spread it around your applicator swab. And so with this applicator swab, you're going to go ahead and get the inside of the mouth first. Make sure it's all nice and moisturized. And then you're going to do the lips. So a lot of times the endotracheal tube have a handle where you can move it back and forth. So always make sure you get both sides when you're cleaning, suctioning, and also when you're putting moisturizer on the patient. So when you're done with these, you always dispose of them. So after 2 hours, then I'll come back and do the next oral care treatment, which is the toothbrush. So I'm going to go ahead and get that ready. So I'm going to have the anti-plaque solution, and we have our toothbrush here. And so with this toothbrush, you're going to go ahead and apply it to your suction handle like that. And so you're going to dip it into your anti-plaque solution, and you're going to go ahead and brush their teeth just like what you would brush your teeth, and do a nice circular motion. You don't want to do it too rough so you don't get any sores on their mouth, irritate their gums, or anything like that. So always get the back of the mouth. And so once you're done, you'll remove this. You can suction out anything if you find anything that needs suction out. Then always, after you do any cleaning or suction, anything like that, you always want to do another applicator swab of moisturizer. So you're going to put it on like toothpaste, spread it around evenly, and then you're going to moisturize the inside of the mouth and also their lips, and dispose of them. So then again, I'll come back after 2 hours. So the next one would be a suction catheter. So with your suction catheter, so you just want to kind of keep it as clean as possible. Don't want to touch it on anything like their bedding or anything like that. So you're going to attach it to the suction handle, and you're going to turn it on, and you can always test it out by suctioning up sterile water if you want to. And then so what you're going to do is go ahead and do the sides of the mouth. You're going to do the back of the mouth and make sure there's no secretions back there. So that way no secretions or anything like that sit above that cuff, and so that way they don't potentially aspirate anything like that. So when you're done, turn off your suction handle, dispose of your suction catheter, and then when you're all finished, every time you do any suctioning, any of that with your oral care, you always want to double check when you're done with the placement of the endotracheal tube. Make sure that's placed in the proper spot that it needs to be, and always check the pressure cuff to make sure that cuff is the appropriate pressure. And then you would always auscultate the patient, and you would also get down the post-vital signs, place them, position them to where they were to make sure they're at the appropriate level that they need to be at. And then I would wash my hands and also go and chart on the patient's chart.